Imogene King was born in West Point, Iowa on January 30th, 1923, to a Catholic family. She was one of three sisters. She was a pioneering American nursing theorist known for her contributions to the field of nursing and theory of goal attainment. She initially had aspired to become a teacher, but decided to go into nursing due to receiving financial support from her uncle, who was a local doctor. She graduated from St. John's School of Nursing with a nursing diploma in 1945, then earned a bachelor's degree from St. Louis University in 1948. She later earned a Master of Science in Nursing in 1957, and then a Doctor of Education from Columbia University Teachers College in 1961. Imogene King advocated for a more complex understanding of the nursing role, challenging the idea that nurses were merely extensions of physicians. She began her career as an instructor at St. John's Hospital School of Nursing and later at Loyola University in Chicago, as well as Ohio State University, where she created the theory of goal attainment, which emphasized the relationship between nurses and patients and the importance of communication in achieving positive health outcomes. This theory introduced a five-step model for nursing practice that included assessing, diagnosing, planning, implementing, and evaluating patient care. She then worked as assistant chief of the research grants at the Division of Nursing from 1966 to 1968. She later taught at and was named Professor Emeritus at the University of South Florida College of Nursing from 1980 to 1990, and then worked as a consultant and speaker in the nursing community until her death. Imogene King received many accolades, including American Nurses Association's Jesse M. Scott Award. She was inducted into the Florida Nurses Association, the American Nurses Association, and the Teachers College of Columbia University Halls of Fame. Her theory of goal attainment is considered fundamental in nursing education and practice, and she was honored as a living legend by the American Academy of Nursing. Her legacy is distinctive in her belief in the transformative power of education and patient-centered nursing. She believed in open communication between the patient and the nurse and created a five-step nursing model, which included assessing the patient's background and history, diagnosing the patient's medical record, examining vital signs, and understanding the specific health issues. She also created a clear plan for achieving a healthy outcome and implemented a plan that carefully measured steps with the collaboration of the patients. She also evaluated the plan as if it was being executed and continued to adjust and approve as needed. She believed that the nurse needed to be in tune with the patient, or otherwise the outcome wouldn't be positive. The philosophical underpinnings of Imogene King's theory of goal attainment are based on the premise that people are open systems in constant interaction within their environment, influenced by systems theory. Some important philosophical points include the importance of nurse-patient relationships, the communication within those relationships, as well as the mutual goal of setting to achieve optimal health. The theory assumes that patients have the right and responsibility to participate in their own care through active collaboration. The core philosophical principles are that humans are open systems, meaning people are viewed as open systems interrelated within their environment. This is the main perspective of systems theory and is the base to the entire model. Health is a dynamic state, which means that health is governed by personal and societal elements where one is able to function socially. The nurse-patient communication is crucial. This theory focuses on the important relationship between the nurse and the goals of the patient. Mutual responsibility is where the nurse-patient relationship impacts the patient's health outcome. It's very important for patients to communicate and collaborate with nurses about their health care goals and to achieve positive health outcomes. Goal-oriented interactions are goals between the nurse and the patient, and they must be the focus within the collaboration in order to obtain a positive patient care outcome. Framework based on systems theory. King's theory is built upon a conceptual system of three systems which reflect the philosophical underpinnings. They are as follows: the personal system, which highlights the person, perception, self, and body image. The interpersonal system, which is the communication, interaction, and transactions. And lastly, the social system, which encompasses organization, power, and decision making.
Description of Imogene King's theory and the theory of goal attainment, human interaction and shared goals, developed by Imogene King in 1981 as part of her conceptual system for nursing, focuses on the dynamic interaction between nurses and patients. Also emphasizes the communication, perception, and mutual goal setting. Health outcomes are achieved through nurse and patient interactions. This theory views nursing as an interactive process between nurse and patient, when both parties communicate effectively through shared common goals, and the desired health outcomes are more likely to be achieved. King's theory of goal attainment remains one of the most enduring frameworks in nursing, emphasizing the interaction between communication and mutual goal setting. Key concepts of King's theory, core elements of the interactive process. These concepts describe how nurses and patients move from perceiving a problem to achieving goals through a process of interaction and shared decision making. Perception. Every individual understands the circumstances distinctly. Communication. Crucial for comprehension and trust. Interaction. Actions and reactions that influence outcome. Transactions. Mutual goal settings leading to action and evaluation. Achievement of goals. The successful outcome of a nurse and patient collaboration. How concepts related to the nursing meta-paradigm, integrating King's concept with the four meta-paradigm elements. King's work aligns perfectly with the nursing meta-paradigm by connecting personal perception, environmental factors, and shared action towards improving health. King's view of the person as a whole system continues to guide holistic nursing practice. Nursing, a process of interaction where the nurse helps the patient identify goals and take action to reach them. Person is a human being. In an open concept, the constant interaction with the environment, a unique perceptor and behavior. Health, a dynamic state of well-being achieved through continuous adapters to stressors. Environment, the background of internal and external factors that influence perception and goal setting. Subtheories. King's three interacting systems, the conceptual system for nursing. King identified three interacting systems that shape our behavior and nursing practice. First, the personal system. Individual perception, self-body, image, time, and space. The interpersonal system. Communication, interaction, role, stress, and transaction. Third is the social system, organizing authority, power, and decision making. Recent literature affirms that the person, interperson, and social systems remain vital for constructing nurses' interactions today. Imogene King's conceptual framework, King's goal of attainment, depicts continual interaction and feedback among systems. This highlights how communication and perception drive transactions. Central outcome is mutual goal attainment. This model visually represents King's belief that all systems, individual, relational, and social, interact dynamically. At the center of this process is the shared goal where successful nursing care takes shape. King's system frameworks visually represents the ongoing process of communication and feedback between nurses and patient.
King's model. King's contribution to nursing science. The nurse is a facilitator of change. Imogene King. King's model integrates human interaction and communication into nursing theory. It offers a structured process for mutual goal setting and evaluation. The theory promotes patient-centered, evidence-based, and collaborative care. And finally, the theory forms the foundation for later mid-range theories of interpersonal relationships.
Imogene King's theory of goal attainment proves itself to be very useful in nursing and in all settings of healthcare, as it promotes individualized care and goal setting. It strengthens patients' autonomy and improves adherence to the treatment plan. King's theory of goal attainment also emphasizes and enhances the nurse-patient communication and relationship. The theory's foundation focuses on identifying patients' needs and encouraging therapeutic communication. Imogene King's theory of goal attainment also focuses on improving patient engagement by involving patients in the discussion and planning of their care. When a patient establishes their goal, they are more motivated and involved in their care. She also focuses on measurable, agreed upon outcomes. If goals are attainable, patients are more likely to complete their plan of care. Another usefulness of King's theory is that it supports clinical decision-making. King's theory serves as a guide to nursing in assessing personal, interpersonal, and social interactions. King's theory also helps nurses to make accurate clinical decisions. King's theory of goal attainment has been used in empirical nursing studies. It has also been used to examine the patient relationship and also used to examine if the mutual goal has been achieved. In measurable concepts enable research testing, her theory has been used to define communication and stress in ways that can be measured or observed. King's theory also supports intervention and outcome evaluations by highlighting the mutual goals set by the nurse and the patient and highlights observable achievement of that goal. King's theory of goal attainment can be applied to chronic illness and management research. It is often used in studies with patients with chronic diseases and used to test how goal setting and shared decision making impacts patient outcomes. King's theory can also be used for quantitative and qualitative research. It is currently used in surveys, intervention research, observational studies, and interviews because at its core, this theory focuses and places a huge emphasis on communication.
Parsimony, King's theory of goal attainment. King's theory is not parsimonious. McGowan and Wills explain that the theory has multiple concepts, assumptions, statements, and relationships throughout different levels. The theory's intricacy aligns with the complexity of human relationships to achieve goal attainment. King's theory can be broadly used with its wide scope and can be the umbrella for many mid-range and practice theories. King's theory has great value in extending nursing science. It extends nursing science through education, nursing practice, and international uses. A nursing researcher from an article in 2025 states, Imogene King's theory of goal attainment is one of the most important nursing models as it comprehensively and deeply addresses patient participation and interaction in the treatment process. King's theory is utilized in many universities throughout the United States, as well as international colleges and universities. King's theory of goal attainment also served as the framework for the baccalaureate program at the Ohio State University School of Nursing. The theory shaped the education process and the essence of their nursing program. King's conceptual theory and model is used in a number of countries throughout the world, including Brazil, Australia, Canada, China, Pakistan, and Sweden. A mid-range theory that is related to King's grand theory is Allgood and May's personal system empathy theory. Allgood and May's theory utilized King's theory of goal attainment to promote an overall deeper connection between the nurse and the patient to improve health outcomes. Allgood and May's theory utilizes the three main systems of King's theory: personal, interpersonal, and social. It also focuses on the individual's personal system to improve self-awareness, improve nurses' awareness of patients' situations, enhance social awareness and social cues, and to amplify mutual respect between nurse and patient. The practical application for Allgood and May's personal system empathy theory is to put yourself in their shoes, to put yourself in your patient's shoes to understand what they're going through and the situation that they're in. In conclusion, Imogene King spent her life working to improve the field of nursing via patient care, teaching in nursing, and creating her nursing theory, which can be applied to all aspects of nursing. King's theory of goal attainment allows for deeper insight into the nurse-patient relationships and interactions with the goal of improving patient care. Her theory has helped shape nursing education, research, and clinical practice around the globe.